Good morning, Mayor.
Good morning.
All right, friends. So we have on the phone with us Denver 7, Fox 31. We have Esteban from Denver Right. We have the Post, and we have Colorado Politics. All of our friends. So we'll get ready in just a second, and we're ready. Mayor Hancock, go ahead and get us started.
Thank you. Good morning, everyone. We wanted to provide an update on our continued response to COVID-19. We're seeing some early encouraging signs that the spread of the virus in our community is beginning to level off. But the plateau's occurring at a dangerously high level, and we need more than just a plateau to feel better. We need a steady decline. So as I said on Monday during the State of the City address, we need everyone to stay the course when it comes to social distancing, mask wearing, and staying home as much as possible. I also want to emphasize something Governor Polis said earlier this week. It's extremely important at the local level for people to comply with our public health restrictions. If cities and counties aren't able to bring the numbers down, it will force even more drastic measures from the state. And so we want everyone to hear that very clearly. Here at the local levels, it's very important that we comply with our public health restrictions. Otherwise, the state will have to take more drastic actions. We don't want that. None of us do. And so we repeat what we've said for the last 3-4 months. Wear your mask, stay 6 feet away from people, and avoid large crowds. I know this isn't easy, particularly how we typically want to spend our summer months, but the alternative is far worse. And so today, we're going to cover 3 main topics. What we're seeing in our state with our case numbers and what we're calling our caution indicators. Secondly, we're going to talk about enforcement around our public health orders and compliance. Thirdly, we're going to talk about our continued work to improve access to testing as well as overall testing capacity. Here's what we're seeing currently. On July 17th, our 7-day average of new daily cases was 72.3. Yesterday, we were at 89.7, a 24.1% rise. But as I've said, we're starting to see some signs that our recent rise might be leveling off. Our positivity rate is at 4.5%. We've been hovering around 4 or 4.5% for over a week. And the fact that we're staying below 5% is an extremely good sign. We, again, as I've repeated in past updates, we want to stay there. The positivity rate in Miami, for example, is 20%. On July 23rd, our 7-day average for the number of people hospitalized with COVID in much of the metro area was 152. We're at 132.6 now. Again, this is a 7-day average, which is 12%, which is a 12.8% decrease. Again, another encouraging sign. Finally, our ICU bed capacity remains strong. About 30% of intensive care beds in the metro area remain available. Again, these are key indicators. So while we seem to be holding our own in this fight against the virus, I want to remind everyone the rise is any one of these caution metrics is concerning. If we see a rise in all 4, well, that would likely trigger additional rollbacks and possible action by the state. Again, this is what we want to avoid. So oftentimes you all ask the question about, what will trigger you to move in, and Bob McDonald is here today, and who is our public health director, and he'll talk more about this in a few minutes. But since last week, we've issued almost 24 citations for violation of those orders that we have in place, most of them for failure to wear face coverings. And the reason, as we study these caution indicators, is a reason why we've stepped up our enforcement, and the reason why we say it's important that we stay the course and we follow these orders, these public health orders that we have in place. Compliance is critical at this stage. Everyone doing their part means that we can get back to fuller reopening sooner. And so we just want to remind everyone, the Denver Public Health and Environment upped their education and enforcement efforts last week, and they're doing it again this weekend. I want to thank those businesses and all of you out there who've been doing your part to follow public health guidelines. As I've said earlier, we need to stay the course, and I'll keep being a broken record about this because this is a public health imperative. It's an economic imperative. And so here we go with the broken record. Wear your mask or face covering when you're out in public. It's not a political statement. Hashtag mask up, hashtag cover up. Secondly, don't gather in large groups and maintain social distancing. It's not an attack on your freedom if you don't get with a bunch of your friends to the park for an afternoon. Hashtag staying together means being apart at this time. Thirdly, keep washing your hands frequently. Hashtag wash up. And finally, if you're a business, please follow the public health guidelines for the safety of your customers and your employees. Cannot stress this enough. Now let's move on to testing. We continue to work with the state on maintaining operations at the state's largest and busiest site over at the Pepsi Center. The site will not be closing down after today. The site will continue to operate uninterrupted for the foreseeable future. And we'll have more on what it looks like hopefully very soon. Again, we continue to have our conversations with the state. They're at the table, very eager for us to chart the more sustainable pathway forward. We know that there's been frustration with delays in getting results. We're frustrated as well, and we're working on ways we can improve timing for results. But keep in mind, increased demand for testing due to spikes in other areas of the country will continue to be a challenge. And there aren't many labs out there turning these results around. And so there are other avenues being looked at, including, I understand, pool testing, which Bob may want to talk about that, which is an interesting concept to help speed up return of results. We also want to start shifting to more of a focus to smaller community testing locations. The purpose is to improve access to those communities that need it most, which may also be the added benefit of getting results sooner as well. Now, I'm going to turn it over to Bob McDonald again. He's our Executive Director for the Denver Department of Public Health and Environment, and he'll bring more about on what we're tracking, our enforcement efforts, and plans for community-based testing. Bob?
Yeah, good morning, Mayor. Thank you. Thank all of you for being with us this morning. And Mayor, I want to thank you for the summary of where we are. You know, as we talk about where we are and where we're going, and we talk about all this data, sometimes it doesn't hit home. And so I want to share some visuals, some graphs with you and some data. And as I go through these, I'm going to touch upon the points a little bit more that the Mayor discussed and give some detail on where we are and what we're doing moving forward. With that, I'm going to share my screen with you here and start talking about, or start with what the epi curve looks like from the beginning. You can see in this screen that in this first set of data here, the cumulative number of cases that we've had in Denver, and we're close to 10,000 at this point. But I want to focus a little bit more on what we are seeing in the graph down below. And you can see here very early on where my cursor is. Hopefully everyone can see that. In the early part of March, when we started to get some of our first cases here in Denver, we implemented that stay-at-home order very early on. And you see the number of cases that we still had after the stay-at-home order was issued. And I'm sometimes asked, well, did that mean that the stay-at-home order didn't work? No, it worked. The whole idea here from very early on is to control the number of cases that we have so that our hospital systems can keep up. And as we determined that and got control of this and started to lift the stay-at-home order and eased up on physical distancing, you can see that we did that in and around here, and things started to climb down as you would expect. But then, after a few incubation periods, after lifting those restrictions, you can see that things start to creep up again, as you might expect, because there's less physical distancing, people are interacting more with each other. And to the mayor's point, we've seen some leveling off here in the last few days, but we still need to be cautious because anytime we're looking at data in the last few days, that will be updated as days move on. And so this could still change here, but this is encouraging that we're starting to see it go down a little bit. The mayor mentioned the metrics that we're going to look at very, very closely moving forward in terms of when it might get to the point where we need to reverse course, meaning that we need to go back and start closing up businesses again. And we absolutely do not want to have to do that. And so it's key that everybody comply with the public health orders that are in place. And those things that we look at are outlined here. Certainly we look at the number of cases. And if we get to the point where we see a doubling of cases in a 2-week period, this metric will go from green to red. And anytime we get into the red, we are on our way to having serious conversations about closing things back up. And I want to pause for a moment here before I forget. I want to thank everyone who has been diligently wearing face coverings, those businesses that are adhering. I want to thank you. We need to keep doing that so that we can manage all of these metrics here and keep them in the green. The other thing I want to take a moment to point out here is that while we're still in the green here, it's important to note that we still need to prepare for other things that are going to be coming. Those things that we need to get back up and running, like the school systems. And so, numbers are still fairly high. And in another few weeks, we're going to have to start having a conversation about what we do with school systems. I'm going to take a moment to adjust my, I'm getting some feedback here that my camera is off a little bit. So I'm going to take just a moment here to correct that. So hopefully that's okay now. So back to the slides here. We also look at the positivity rate for what level of positive tests are we seeing come back from the testing that we're doing. The mayor had mentioned that we've been hovering under 5%, which is good, but we want to make sure that it stays below that. And with any one of these, there are nuances. If we need to focus more on those that are symptomatic or scale back testing because there's a shortage of lab supplies, then of course positivity rate goes back up. And then of course, from very early on, we've been saying we need to manage our case numbers so that hospitals can keep up. And we take a look at the number of admissions to hospital systems, and then a subset within that is what does ICU capacity look like? And I'll very quickly break these down so that we can get into some Q&A. So with respect to doubling of positivity rates, as I said, or doubling of case rates, as I said, we are still in the green here. But I want to remind everyone again that we need to account for school systems getting back up and running. And although we're seeing a younger demographic in terms of who is showing up as positive these days, our younger population can very easily transmit that to the elderly population and those that will struggle a little bit more with this virus. Positivity rate, you can see very early on here when we were focusing very early in the pandemic on those with symptoms. As I said, positivity rate goes up. And then as we conduct more testing, you can see, of course, the positivity rate goes down because we're testing more people that do not have symptoms. Now, there is value in doing that because we can detect some asymptomatic individuals and get them quarantined. So we're going to continue to do that to the extent that testing supplies and return on testing results can keep up. So still in the green on this metric here. And then again, the other two metrics have to do with hospitalizations. Very early on, we saw a number of individuals, primarily those in our elderly community, needing to get medical care, and that has gone way down since the beginning of the pandemic and has stayed relatively low. But again, the reason it's staying relatively low is because we're seeing a younger demographic here with positive results, but they can, again, always transmit that to those who will suffer a little bit more with this virus. And then the subset that I mentioned with ICU capacity within hospitalizations, still very, very stable. And the goal, of course, is to keep that stable by managing the number of cases in all populations so that it doesn't transmit to people who are more susceptible to the harms of this virus. With that, I just want to stress a couple of other things. We more than ever, this can boil over at any point in time. We need to be diligent with enforcement. Public health officials and sheriffs will be out in force this weekend and moving forward, not just enforcing face coverings, but all components of our public health orders, including capacity, social distancing, and making sure that people are wearing their face coverings. We're not just going to be looking at face coverings. We're going to be enforcing against all of that, including the recent restriction on liquor sales after 10 p.m. We'll be looking at all of that late into the evenings, doing those assessments, and we are going to take enforcement if we see non-compliance with anything in those public health orders. And with that, I will turn it back over to the mayor or Teresa Marchetta.
Thank you, Bob. And I just want to join Bob to once again stress that it's our responsibility to do what we can to keep each other safe and healthy. And as we approach the weekend, it's going to be a gorgeous weekend here in Denver and throughout Colorado. I think we're expecting mid-80s, so it's going to be the perfect weekend to be out and about, reminding everyone to wear their face coverings and to practice social distancing and as best you can avoid large group. Because this is, again, far from over. The time is right now to do everything we can to combat the spread of this virus and get everything back under control. The numbers are indicating that we're headed in the right direction. We're still worried about the plateau that we're sitting on, but we want to maintain the direction we're going, and we need some, quite frankly, some real dramatic decreases. And so I'm asking everyone to stay the course. And that's it for this update so far on COVID-19. Let's go to questions.
Hi, Mayor. This is Esteban Hernandez with Denverite. Sort of a two-part question. When will Maury Middle School be cleared from the homeless encampment there? And then also, given the criticism from some of the service providers that the Lincoln Park cleanup was poorly planned, what measures is your staff taking to ensure people camping at Maury will have a place to go when they are forced to leave?
Mayor, let me interject really quick, 1 second. So if there are any questions regarding what the mayor and Bob just covered specific to COVID, which is what the purpose of this call is for initially, I'd like to address those first, and then we can get to any additional questions outside of the content that the mayor and Executive Director McDonald just covered. So does anyone have any questions specific to COVID, please?
Yeah, this is Michael Karlik with Colorado Politics. This is in reference to the caution metrics slide that you displayed. I see that the concerning level is a 100% or greater increase in cases over 7 days, and anything less than that is merely watching. How is any increase in cases, let alone a near doubling of cases, not concerning to the city?
Bob?
Yeah, I apologize. I'm having some technical difficulties here. I'd appreciate if you could just repeat the question, and I'll be brief with my response.
Why are you not considering increases in cases less than 100% concerning?
Well, we're not saying it's not concerning. It is concerning. And in fact, I'm sorry?
That's what the slide says. The labels on it, the thresholds are watching and concerning.
Yeah, I mean, where we're at, let me be clear on this. Perhaps I confused some. Where we are in terms of did we meet the threshold for reversing? No, we're not, but that doesn't mean, and you'll see that the slide demonstrates that we are in the green with that. And so, but that doesn't mean that we aren't concerned with the numbers that we've seen. We are concerned with what we're seeing, and all the more reason to be diligent with where we're going. At any point in time with this virus, it's very infectious, very easy to spread. And those numbers that you just saw and that epi curve that I just referenced can grow logarithmically very, very quickly in a matter of days or weeks, and it can shoot off the chart. So if there is the impression that we are in the green and so there are no concerns, that's not really what that means. There are concerns, and we need to be diligent about complying with orders.
Okay, thank you.
Anything else on the COVID front before we get back to Esteban?
The question I had is David Clue from Denver 7. Is COVID related, if I may? And Mayor, I know this to be a bit of a vicious circle, but the most recent homeless sweep at Lincoln Park did include buses to transport those being moved to shelters. Not one took the city up on that, claiming the shelters aren't safe. So whether it's COVID or violence or mixing mental health issues with addiction, is the argument that the shelters here in Denver for the homeless are not safe valid? And how do you change that impression?
You know, we're not only am I joined by Bob McDonald, but I see Britta Fisher here as well. And you know what? We have a lot of misperceptions about the shelter systems. And I think one of the things that you're going to hear continuously from us anyway is that we are seeing on average of 550 beds available for people every day that are not being taken in our shelters. And while we are doing everything we can to blunt the spread and transmission of the virus, we are seeing a minimum spread even in our congregate care facilities on the inside in our shelters because of the management and protocols that have been put in place to blunt the transmission. But I'll ask Britta Fisher to chime in here. Britta, welcome.
Thanks, sir. Just one correction to your statement is that, yes, we did actually have one person take a bus to the shelter. The overall question was about the safety of our shelters, and our shelters are safe. We have taken big measures here as a city of Denver to ensure that we have proper space and have integrated healthcare, both primary and mental health care, screening and triage. We have a regimen of testing that continues with our partners at Denver Public Health and Environment, as well as with Denver Public Health. And so we think that overall, yes, our shelters are safe. Now, that doesn't mean that that is what every person will say who is outside, but we have done a lot in order to help ensure that it is safe. And our recent survey of the National Western Centers shows that actually 16% of the people who are sleeping there did in fact sleep rough or sleep outside before coming to the shelter. So certainly that environment with good meals, assigned beds, plenty of space has attracted people who were formerly sleeping outside to come inside and seek services.
And
I want to get
Britta,
back to Esteban next, if I could. Or Bob, did you have something to add before I do that?
Yeah, if you don't mind, I would just like to add to this, because I got this question yesterday when the park was being closed, that, are the shelters safe, and how do you compare the risk of COVID-19 exposure in a shelter versus encampments? And it's important to understand that I understand why it's easy to look at it that way, but what people don't understand and what is not often understood is that we are seeing many other types of outbreaks in the types of conditions that we saw yesterday in Lincoln Park. And so I want to be careful that we just don't look at the rate and incident of COVID-19 in those types of venues, because we are battling a Shigella outbreak, hepatitis A we've been trying to control in encampment settings. And then there are all the other public health concerns that you see in encampments, needle waste and rodent infestation and trash and many other things that you're not going to see in shelters. So I just want to point that out, that there are many things, public health risks in encampments that you would never see in a shelter.
So let me go back to Esteban's questions that he asked me, and we're obviously not going to talk about specific strategies around Maury or any other encampment, but what you're going to continue to see, and I said this during the State of City address, and I'll continue to repeat it. Over 80% of the people of Denver made it very clear last year that public encampments, or at least neighborhood encampments, are not what they want in the city of Denver. And I absolutely agree with that position. We don't find them to be safe, sanitary, or humane. And we certainly didn't find this encampment over here at Veterans Park to meet a humane, safe, or healthy environment. And we certainly do not see that with regards to Maury and some of the other encampments that we find. So we will continue to be diligent with regards to the cleaning as well as the breakdown of these encampments. We continue to work to make sure there's enough space for everyone to move to moving forward, going and making sure that we can properly accommodate those who are unsheltered in our city. But let me say this as well. We know what the CDC guidelines say. These are very difficult decisions. We have to find the very complicated opportunity for balance here. And that means that we not only have to protect our neighbors who are experiencing homelessness while in these encampments. And you've got Shigella, and you've got Hep A, and you've got COVID, and you've got rat infestation, you've got needles that are haphazardly around and other threats. We had a triple shooting over here at Veteran Park the other day. We've had some incidents of violence over in Maury. I saw a video yesterday of someone being brutally attacked by two other members of an encampment in another location in downtown. We have a balancing act that we have to achieve here. And we have to not only take care of and protect those who are in the encampments, but we have to protect and keep safe the general public. And it's unfortunate that people want to politicize this, but we are pursuing public health and safety for everyone in and around these encampments. And we're not going to compromise on that. And when we are investing in excess of $100 million as a city to care for those who are homeless in our city, as well as if you look at the other investments happening with housing, and this will be brought out during the budget process, in excess of $400 million a year. This is your city and other agencies that are working toward handling those who are housing insecure and unsheltered in our city. And there's a lot of work going on. So, we know that we can care for those at least temporarily until we can get them stabilized, but we cannot allow for these encampments to persist in our city. Period.
Mayor, this is Esteban. Why can't you talk specifically about the strategy around Maury Middle School?
Because we unfortunately, Esteban, if I could be very candid, have people who want to put our public health workers, our DOTI officials, and our law enforcement officers in danger by tipping off folks who want to come in and escalate the situation. And we know that. We know for a fact that there's a city council member who is texting and sending out information, trying to get people to show up and protest. We know that, and it's putting everyone at risk. And it's unfortunate because we have, when people are showing up to do their job and try to help folks, we now create an escalation. So, I'm not going to mince words. It's not okay. It's putting everyone at risk. And it's not helping anyone when those sort of things happen. So, no, we're not going to sit up here and publicize the exact time, place, and location. We're going to be diligent. We're going to do everything we can to protect those who are homeless in our community, as well as the public officials who are going in to try to provide those services.
Hey, Mayor, this is Conrad over at the Denver Post. Isn't the city also required to give residents of those encampments at least a week's notice before those camps are broken up?
I'm going to ask Bob to respond to that because it's not just across the board. There are reasons. I'll let Bob go ahead and address it.
Yeah, no, if it's a general cleaning that's done by the by DOTI, Department of Transportation and Infrastructure, and they need to move people in order to get that cleaning done, then there is a requirement to post for 7 days. If this department determines that it's reached that point, any of these encampments where there's an imminent public health risk, there is not a requirement to post notice and to move immediately. And that's what occurred yesterday.
Thanks, Bob. Anybody else have any final questions? We got to wrap it up.
Yes, I do. This is Vicente with Fox 31. Can you hear me? Okay, yes. There was also the incident involving Tay Anderson. Mayor, can you tell us about the city's approach in terms of how the city will be handling and maybe speaking with the police department about what happened with Tay Anderson and the incident that was caught on videotape there?
Vicente, everything is being looked at this point in time, and there's, I don't have much to say about that until we know more. I've seen seen some of the videos. It's really hard to tell, but it is under review at this point in time.
All right. Thank you so much for joining us, everybody. Happy to follow up individually if needed. So thanks for